Next, I'm going to ask Dr. Sarah Callinan from the Centre for Alcohol Policy Research in Melbourne, Australia, to present to us. Thanks, Sarah.
So I'm going to be talking to you today about shifts in alcohol consumption during the COVID-19 pandemic in Australia. And I'd just like to start off by acknowledging that I'm currently sitting in the land of the Wurundjeri people and that their sovereignty over these lands was never ceded. So I thought I would start off with just a bit of background about COVID in Australia, because the waves that we had are relevant to the results I'm going to be presenting. And I'm only talking about 2020 here. So we experienced relatively few cases of COVID-19 here in Australia, partly due to geographical luck and partly due to very strict lockdowns when we did have outbreaks. And as you can see here, we sort of had two waves in 2020 with some very fortunate periods of, basically hardly any cases in between. There was one wave that affected, the whole country, and the whole country was affected. And then there was a second, much larger wave that only occurred in one state in Australia, in the state of Victoria. So the first wave, in our lockdown from March 29 until May 16, we're only allowed to leave our homes for the 4 reasons. That was healthcare, exercise, shopping for essentials, and essential work and education. And schools were closed, parents needed to homeschool. In the second wave, which was just in Victoria, so for most of last year, most of the other states after that first wave lived relatively normal lives. There were still some restrictions on premise density and things like that, but no lockdowns. But in Victoria, from mid-June to mid-October, there was an extremely strict lockdown, as well as the 4 reasons. There was also a curfew. You couldn't move more than 5 kilometres from your home. There was a mask mandate anywhere outside your own home, and a permit system for essential workers. And the easing of these restrictions was extremely slow, and life didn't return to COVID normal until local transmission had ceased. During this period, bottle shops remained open. However, before lockdowns were announced, there was often panic buying anyway. Many restaurants and bars delivered alcohol or sold it for takeaway during the lockdowns to stay afloat. And requests for help seeking also increased during the pandemic. So alcohol treatment services did receive more calls for people asking for assistance with themselves or loved ones and requests for treatment. So we ran 2 longitudinal studies throughout 2020 to assess how alcohol consumption shifted in Australia in response to the pandemic. In both of these studies, we recruited convenience samples through ads on Facebook and Instagram. The inclusion criterion were being Australian, aged 18 and over, consuming alcohol at least monthly. This meant 2 main things to keep in mind when you're looking at these results. One, that our results aren't representative of the Australian population because we used a convenience sample. And 2, a lot of our results on average consumption are a bit higher than you would expect because we don't have abstainers or intermittent drinkers bringing the average down. Study 1 was very opportunistic. We actually had something going out in the field in March when everything started to, break here. And so we quickly requested and we were able to change the audit. So we asked it twice, once for 2019 and once for the month prior to the survey. We ended up getting 1,700 participants, nearly 2/3 were female, and we asked them the audit, and we also asked them the stress subscale from the DASS and some demographic items. This is as far as those 2 waves go that we had here, this is when this survey was administered. We were still very much in lockdown at this point. And what we found was overall people drank more often. They reported at least drinking more often, but they reported drinking less per occasion. They reported drinking riskily less. And because of that, the scores on the dependent subscale and the harms questions that we could ask in the survey also decreased, with one exception. So people were drinking more often, but they were drinking less when they did. We did look into these results in more detail, and I've got links to the paper at the end. But one result that I just thought I would share with you is that we were interested to see if we could find any indication of what was going on with the increased calls for treatment in our data. And the one thing we did find is that people who reported high levels of stress throughout the pandemic did report an increased score in the dependent subscale of the audit. And that's the subscale that's got the close link to, needing treatment and so on. In terms of study 2, this study was written more specifically to assess drinking during COVID in Australia. We got 2,400 people, 43% identified as male, and we had questions about, all our questions about alcohol consumption were location specific. So we asked people about their consumption in 2019 and in 2020, we asked them about where they drank their alcohol as well as how much. And we asked some other questions along the way as well. Again, this survey was administered here and we were still in lockdown at this point. And so when they were looking back at the past month, they'd been in lockdown that time. And so what we found is very much in line with research we have done with representative samples in the past in Australia. Approximately 2/3 of all alcohol consumed in Australia is consumed in the drinker's own home. And that's what we found in 2019 for this sample, even though it was just the people who were drinking at least monthly. The other quarter was being consumed in other people's homes, licensed premises and in public. And in 2020, in wave 1, where I showed you the arrow, home drinking did increase, but it did not increase enough to compensate for the fact that you weren't able to drink or shouldn't be drinking in those other locations, particularly the loss of being able to drink in licensed premises. We then ran the same analysis again, but we stratified it by gender down here and also by age. And what we found is that the most interesting sort of group here was the young men. This was the group of people who consumed the least amount of their alcohol in 2019, or the lowest proportion of their alcohol in 2019, inside their own home. So it kind of makes sense that these seem to be the group that was the most affected. If you're drinking less in your own home in 2019, and then that's the only place you can drink, you might have your drinking more heavily affected. And so even though their home drinking did increase quite a bit, it didn't increase enough to compensate for the fact that they weren't supposed to be able to drink in any of these other places. However, in all our other demographic groups, roughly speaking, people increased their home consumption enough to compensate for the fact that they weren't able or weren't supposed to be drinking elsewhere. In terms of our more longitudinal results, and I cannot stress enough, the results I'm showing here are very preliminary. We haven't cleaned our data properly or accounted for attrition here. And I'll let you know at the end where you can see our much shinier and probably better results when they're available. But what we have here is we asked people to continue filling out the same survey throughout the pandemic. And so these are the waves where we ask people to continue asking the survey. I'll just go back for a second. In terms of the lockdown in Victoria, in wave 3, wave 4, and pretty much wave 5, Victoria was in lockdown. There was some restrictions being loosened at wave 5, but it was still actually quite strict because local transmission hadn't ceased yet. So it wasn't until wave 6 where Victoria was as free as the rest of the country, really. And as you can see here, in wave 1, as you saw in the other graph before, drinking in the home shot up, between sort of 35 and 40%, depending on the state. And then when we got to these waves 3 to 5, where Victoria was in lockdown, but the rest of the country wasn't, home drinking came up again, but it was really sort of hovering even slightly lower than it was in the previous waves outside of Australia. In terms of drinking in licensed premises, during the first lockdown dropped, as you would expect, nearly 100%. But in Victoria, it stayed very low. But in all the other states that reported, despite density limits and so on being in place in some of those places, it nearly bounced back up. We think some of the declines down here are about attrition. And so, these results are preliminary, but we're sort of finding that it does look like people were bouncing back to their previous habits. So overall, we do think that during the lockdowns anyway, Australians may have decreased their harmful drinking, particularly among young adults. This is despite an increase in how often people were drinking. I kind of think that the decrease in young adults was probably more about where they drank in 2019 than anything to do with their age. But something we're keen to really look into, particularly for the Victorians, that we've assessed is whether or not this more frequent consumption in the home is a habit that's harder to shake, especially if it's something that you did for that longer Victorian lockdown. Home drinking is thought to be very habitual. It's not something that we think about a lot. It's kind of just something, there's times of the day or night that people have a drink, and it's not something that is as purposeful, I think, as drinking in licensed premises and other places. And so one thing we're really keen to follow up on and see is, particularly with the Victorians, is if you increased your home drinking, how did you go in bringing that back down again when you were able to drink in the pub or in your friend's house or so on and so forth. So that's something we're really keen to look into. What we didn't get is much to indicate why there was that high increase in requests for treatment. We think that's partly that this particular study probably wasn't well suited to picking those people up. The people looking for treatment tend to be the pointy end of the distribution, and a sort of big general convenience sample might not be picking up those people well. However, we did sort of get some idea that it might have been, stress, pandemic-related stress, which is a pretty reasonable hypothesis there. Limitations, it's a convenience sample. Like I mentioned, we were a bit concerned about attrition, particularly towards the end, and also regression to the mean. I'd just like to acknowledge my co-authors quickly, particularly Yvette Mohica Perez, who did a mountain of work on this study. She's doing her PhD on this data. So when I said we're going to have better results in the future, it's not because I'm going to be doing it, it's because Yvette's going to be doing it. And I strongly recommend you look out for her work because I think it's going to be excellent. We do have 2 papers out from these studies so far, but, Yvette, I think in particular, will be putting out more in the future. Thank you.
Thank you very much, Sarah. I know her, sorry, personally, that's my nickname for her. There's one question here. I will say Yvette, who Sarah mentioned, is going to write a blog post as well following this session, so that we can do a link to that as well. So Dr. Addy, I'm going to save your question till the end because we can ask it of all 4 speakers. Sorry, pronunciation, Elsa Rutter, for Sarah. Have you got alcohol-related deaths data yet for Australia?
If we have, I haven't seen it. Not to my knowledge, no. We'll be really interested to see. I'm hopeful that the kind of and I think some other studies were finding similar patterns. But if what we found in our convenience sample is representative, I'd like to hope that maybe we might get a reduction. But then what the calls for treatment and so on might indicate that might not be the case. But fingers crossed. I
wanted to ask about the persistence of home drinking following a period of lockdown. And the question is, I think, so your study will have the ability to compare people who were in lockdown in New South Wales, which was a much shorter period than those in Victoria. And you could look at the effect of length of lockdown on persistence of consumption pattern changes.
Yeah, we're really keen. We're really keen to do that. I think it does look like outside of Victoria that things bounced back fairly well, so that's a good sign, at least in our sample. But with the longer lockdown in Victoria, we're quite keen to see if that's what's happening there. And of course, that would have ramifications for, say, Sydney in 2021. It really is the work we've been doing on home drinking at CAPER, the one thing that comes through is people don't really think about it, and they don't, it's just a lot less deliberate. And because of that, I am concerned that if you get into the habit of drinking every night, even if you were drinking less per occasion than you were when you were able to go out, if you then have those weeknight regular drinks that you weren't having before, and then you're able to go out on the weekend as well, once you're free again, that can lead to higher total consumption. So, and then all the harms that come with that. So that's something we're particularly keen to keep an eye on, and we're really keen to assess and also using, other data sources when they become available as well, obviously.